Hi, it's Pinky here. I'm an international board certified lactation consultant, and I've got some tips for you today about weaning from top-ups to be able to hopefully exclusively breastfeed your baby. Now, there are some medical conditions that may mean you won't get to exclusive breastfeeding, but I've had clients who have had medical issues. Perhaps they've had, polycystic ovarian syndrome that can interfere with their hormonal balances. Sometimes they have had a condition called insufficient glandular tissue or breast hyperplasia, which means there aren't actually enough breast ducts to make a complete milk supply. But then there are other women who've had delayed onset of lactation when they've had their babies. Perhaps they've been advised to top up because their babies were having slow weight gain. There's various reasons why people may have been given advice to top up their babies. And while sometimes this isn't actually necessary, I don't want to argue with people who've had medical advice at all, but sometimes people just think their baby's hungry and they start with a top up and it becomes this top up trap. And, a baby that's probably going quite all right, but might be having a growth spurt, and perhaps the parents aren't aware that babies can just, step up their feeds, but then they get anxious that there's something wrong with my milk or my breasts have softened, and which they do. Initially your breasts are nice and firm and a lot of that's extra blood circulation. And then as the breasts soften and the baby starts to cluster feed, which is very normal, feeding frequently for short periods of time, either during the day or often in the evening, women think, I haven't got enough milk. So they will reach for the bottle, give their baby a top up, and that baby will gulp down the bottle because very often people are holding the bottle upright, baby's lying on his back, and the baby's gulping that bottle to protect his airway. And so it looks like he's been very hungry, he's drunk that whole bottle full, then he conks out and goes to sleep for quite a long time. And it just becomes a trap that, you offer a top up, your breasts don't get the signal to make more milk. So then your milk supply is going down, so you add in another bottle, and somewhere down the track, it can be quite devastating because you don't even realise that your baby's actually weaning as the baby's taking more and more top-ups and less breast milk. Your body's not getting the signal to make more milk because the baby's sleeping longer and all that. So how do we wean off these top-ups if it's okay? Get some supervision. See an international board certified lactation consultant. Check with your child health nurse or if you've got a good doctor, pediatrician, whatever. Check with a trusted medical advisor around that your baby is now thriving and you can gradually cut back on this top-ups. Now, one way to do this is to just go gradually, because sometimes if you go too hard, you become stressed. And if your baby's having a reasonable amount of top-up, if it's formula, ideally it would be donor milk, it would be express breast milk. These would be the ideal, but very often it happens to be formula. So let's just get real about what's happening. So anyway, your baby's being fed milk. But if your breast milk supply has gone down, often you can't do this suddenly, and it's better to go carefully if this is what you need to do, if this has been going on for a while. So what I suggest is cutting back however much top up your baby is having over a 24-hour period. Try and measure that back 30 mils over the 24 hours. Go back 30 mils. So this might mean 5 or 10 mils less in a bottle. Oops, my laptop's moving. It might be 5 or 10 mils less per bottle. Your baby will hardly notice this. But what you do is you do this for about 3 days. Keep an eye on your baby's nappies. And if nappies are good, weight gain's okay, not being impacted. Your baby might feed a bit more frequently if he's having a bit less top up. And then over that 3 days, if things are okay, you can go another 30 mils over the 24-hour period. Don't go too hard, just do it gradually. And it won't take long, and you'll be more breast milk, less top up. If you like, if you haven't been giving much top up and you're not been doing it for too long, you can just spend a period of time, perhaps a morning, skin to skin, snuggling your baby, breastfeeding every time that baby goes or moves his mouth or moves his head or moves his hands towards his mouth, just pop the breast in. Another thing you can do is every time your baby wakes up, give him the breast. As he falls asleep, give him the breast, so that you're stimulating those breasts. You can use a breast pump between feeds if you want to, and that will stimulate. Don't worry about the amount you get, because it's not really about the amount, and an effectively sucking baby is always going to get more than even a really good breast pump. But you can use that breast pump between feeds, and anything you get, if you've got 20 or 30 mils that you've pumped, that can be your baby's next top up. So, and then gradually you'll be getting more breast milk, less of other stuff, whether it's formula or whatever you've got. So you'll be able to give more and more breast milk, and you'll get there. If you do have a medical condition that means you can't quite make a full, exclusively breastfeed, that's okay. Every breastfeed is a success. Every bit of breastfeed you give your baby is helping with his immunity. That oral sucking at your breast is helping him develop his jaw and his tongue function. It's really, and his speech muscles, it's all helping. So, don't feel that you have to wean because you don't have enough milk. You can supplement, but if you want to cut back the supplements, doing it gradually is really the best way to do it. And another thing, if you are supplementing, finish at the breast. Once you've given your baby a bottle, if you're using a bottle, and I'll explain something else in a minute. If you are using a bottle, put your baby back on the breast after he's had a bottle. He may not suck very vigorously, he might have a nice full tummy, but if he's had the breast first, he's had the bottle, and you finish at the breast, he's associating that breast with his full tummy, so full tummy and mummy, and he's much less likely to refuse the breast in favour of that possibly faster flowing bottle. If you are using a bottle, please use a slow flow bottle and hold it horizontal, tilt it down every few minutes, and then let it up. It's, on baby's lip, tilt it down, hold it up again, let him draw it back into his mouth, because that's giving him a chance to breathe. It's called pace bottle feeding, and I do have a blog about this, about how to give your baby a bottle, your breastfed baby, or any baby really, because we don't want to go tipping bottles up high. Babies have to go, and just, you imagine if you're lying flat on your back and drinking out of a hose, you'd have to swallow really quickly. So, doing that very gradually reducing the top-ups, keeping a very good eye on your baby's output, that he's having, at least 5 heavy wet nappies a day. If you have a period of dry nappies, just go back, go to the top-up, possibly. Whether that's some express breast milk, whatever you've got. But, going gradually and working it backwards. Sometimes people can do this in about 48 hours. Other times, if you've been given quite a lot of supplement, it's about going slowly. You'll get there, okay? And there is an alternative to a bottle too. There's a device called a supplementary nursing system, which is a little device that hangs around your neck, a container for the milk, and there's a very fine tube that goes against your breast into the baby's mouth, so that as he's sucking at your breast, he's also getting milk from this fine tube. But again, that has to be managed very, very carefully so that your baby is actually draining your breast effectively while he's using this thing, this device. So again, seeing a lactation consultant, going to a breastfeeding clinic, getting the support you need, and having your baby monitored as you reduce those supplements, and it can be done safely so that you can end up, fully breastfeeding, exclusively breastfeeding, or possibly continuing that breastfeeding journey. If, for instance, there is a medical condition, that you can continue that breastfeeding journey until, I've had clients that's babies have got to 7 or 8 months, they're eating family foods, they're having the breast, they've been able to ditch those, those supplements, whether that's been a supplementary nursing system or whether it's been a bottle, and they've been able to ditch those somewhere between, I suppose, 6 and 9 months, somewhere. Mostly they can be ditched, and they just feel like a breastfeeding mother, a fully breastfeeding mother, because the baby's having family foods, he's having the breast, and those mums have actually had their babies still on the breast as toddlers. And it's just so beautiful because they haven't gone through that grief of the baby weaning on preference to a bottle and rejecting the breast. So, the more you can manage, the better. And you can use the breast as comfort, even if you haven't got a full breast. So, just Remember, you can do this all very, very gradually, and it is absolutely possible to wean from the supplements back to the breast.